Good morning. Today we mark a year since the first national lockdown. A year that has stretched and challenged us in ways we would not have imagined, and which has carved out of us resources of strength, depth and courage we did not know we had. For those of us of all faiths and of no faith. And so let us remember in sorrow all those who have died, whether family, friends, family, or those we have cared for. And as we remember them, we also remember our colleagues who have died. Raji Mahideen, healthcare assistant on Tabery Ward at Newham. Van Lang Huang, a patient transport driver. Mark Wilcott, an ambulance care assistant. Dr. Habib Babu, known to us all as Babu, an SHO at FAU at Whips here. Vincent Lawler, a sexual health advisor at the Royal London Hospital. Jeff Edwards, a former porter here at Whips. Greg Serwin, a health records porter working at the Royal London Hospital and across the Trust. Mani Okoro, from the patient transport team. And Elias Feary, a sexual health advisor at the Royal London Hospital. Let us remember with compassion all those who have suffered during this last year, whether through illness, stress, financial ruin, or family tensions. As we remember them, we recognise our own needs for resilience, for courage, and for a willingness to forgive. Let us remember with grateful heart the generosity, inventiveness, self-sacrifice and determination shown by so many in this most difficult of times. As we remember those to whom we owe so much, we extend our gratitude for their gifts and dedication in their various roles. As healthcare colleagues, scientists, politicians, public servants of every kind, community leaders, or family members and friends, unwavering in their support and continuing to show such love and compassion. Let us remember in hope that as the pandemic is contained and we experience greater freedom, we will reflect on the lessons we have learned and seek to create a society that is more compassionate, less disfigured by inequalities, and more responsive to the needs of those who suffer deprivation of whatever kind. And so we keep a moment's silence now. As we conclude our moment of silence, let us acknowledge the many challenges that lie ahead of us as we seek renewed strength, determination, and hope.
Thank you. As we remember our colleagues that are not with us as we exit this year, I wanted to also take an opportunity to thank my colleagues for everything they've done. We are the generation that is going to have been part of delivering the recovery of the pandemic, and I hope that you take pride in the roles and the complex ideas and solutions that we have come up with in order to be where we are today. To think that we will be part of history as is the Spanish flu and pandemics before us. In 10, 20 years' time, our colleagues will be looking to us to make sure that we've captured everything that we've learned. If I think it was just a year ago that our amazing staff worked with us as we undertook infection control measures that we have never been confronted with before, the work that we did to understand PPE, our subject matter experts that helped us use that effectively, and how we've used it quite differently as we've learned from those experiences. The exceptional efforts of our redeployed staff, the changing of wards every day. I don't believe that there is a single person that's worked frontline that has actually done the job that they were doing in the year before. We've all had to work differently, but redeployment has been something that every member of staff has embraced every time the system has asked. But alongside those colleagues that have been delivering care frontline to our patients, we've had extraordinary preparatory works that have helped us improve our environment. Our estates team have worked on segregation, the AAU and ED segregation so that people can get into our services safely. We were the first emergency department to move to a COVID status where every patient was assumed query COVID as they arrived. Our ED X-ray upgrades that are still ongoing despite the pandemic. The Curie Ward, Nightingale, Elizabeth and Acacia refurbs, the refurbishments across in surgery, the amazing estates team and all the independent providers that ensure that that still continues is of amazement to me. The vaccination hub, the latest addition to our portfolio, delivered 10,000 doses of the first dose. They're now well into over 1,000 of the second dose, with an ambition to make sure that everybody got their first dose will get their second. There is so much to be thankful for, alongside our partners in Serco, who have supported us in the provision of food, support for our patients through the porters, our domestics that have turned deep cleaning into an exceptional industry, but have again responded to every ask that we've made of them. As we remember the colleagues that are not with us today, thank every single person that's been part of this journey, and wish us well as we recover throughout the next 2 or 3 years. Thank you.